My name is Melinda, and I was diagnosed with metastatic breast cancer in 2012. I'm a proud U.S. veteran and a military mom whose family represents 3 generations of military aviators. I was initially diagnosed with stage 1 breast cancer in 2004. At that time, I had a lumpectomy and radiation and went into remission. In 2012, the doctors found a lump on my collarbone, and we had a biopsy. At that point, it was determined that I had stage 4 metastatic breast cancer and that I was HER2 positive. When I first got the diagnosis that the cancer had returned, I was totally caught off guard. I wasn't sure what was going to happen. I wasn't sure what the treatment would be. It just took me for a loop, and it took a while to get the information I needed to start to take care of myself in the treatment. I had chemotherapy, surgery, I had double mastectomy, and then radiation. And that just changed everything because then I knew I was living with cancer, that I'd have cancer and I'd live with it for the rest of my life and be on some kind of treatment for the rest of my life. With metastatic breast cancer, a treatment doesn't always work continuously. So I've had several lines of treatments since my initial diagnosis. And a couple of years ago, my doctor was concerned with some things and decided to change up the medicine. I sat down with the doctor and discussed some of my options, and she brought up taking Tukysa. In talking with my doctor about moving on to taking Tukysa, she went over the risks and benefits for me and possible side effects. And I decided then that it was worth it for me to go ahead and start the medicine. And not everybody has the same side effects. It can be different for everyone. For me, what I experienced was occasional nausea, occasional diarrhea, and a little bit more fatigue here and there. But it was well worth it for me to switch to this medicine, and the benefits were outweighed the risks and the side effects. At a follow-up appointment with my doctor after I started Tukysa, we did some tests, and the doctor and I both were very excited to see the results. I choose to share my story because I don't know that everyone understands what metastatic breast cancer is. It is something that will stay with you for your rest of your life. You'll be in treatment for the rest of your life. I have people ask me that says, "Oh, are you almost done? Are you cured yet?" And I have to explain to them that I won't be cured. This is a chronic disease that I live with. Years ago, saw a sign that said, "Choose joy." And that just really hit home to me. I'm going to wake up every day and make my choice to choose joy and to be happy. And it's not easy. It's not easy every day to maintain a more positive outlook. But I feel that it's helped me keep living like I am and to be able to help other people when they need some insight. Maybe my purpose is to teach somebody who's going into something and who's afraid that it's okay to take a breath and move forward. I just know that this is the way I'm meant to be, and this is my path in life right now.
Indication. What is Tukysa? Tukysa is a prescription medicine used with the medicines trastuzumab and capecitabine to treat adults with human epidermal growth factor receptor 2 HER2 positive breast cancer that has spread to other parts of the body, such as the brain, metastatic, or that cannot be removed by surgery, and who have received 1 or more anti-HER2 breast cancer treatments. It is not known if Tukysa is safe and effective in children. Important safety information. What are the possible side effects of Tukysa? Tukysa may cause serious side effects, including diarrhea. Watery, loose, or frequent stools is common and can sometimes be severe. Tell your healthcare provider if you have a change in your bowel movements or severe diarrhea. Severe diarrhea can cause a loss of too much body fluids, dehydration, low blood pressure, kidney problems, and death. Your healthcare provider may prescribe medicines to treat your diarrhea during treatment with Tukysa. Liver problems, including severe cases. Your healthcare provider will test your blood to check your liver function before starting and every 3 weeks during treatment with Tukysa or as needed. Tell your healthcare provider right away if you have any signs and symptoms of liver problems, including itching, yellowing of your skin or eyes, dark or brown urine, tea-colored, pain in the right upper stomach area, abdomen, feeling very tired, decreased appetite, or bleeding or bruising more easily than normal. The most common side effects of Tukysa in combination with trastuzumab and capecitabine in adults with HER2-positive breast cancer include diarrhea, rash, redness, pain, swelling, or blisters on the palms of your hands or soles of your feet, nausea, increased liver function blood tests, vomiting, mouth sores, stomatitis, decreased appetite, a low number of red blood cells, anemia, and rash. Your healthcare provider may change your dose of Tukysa, temporarily stop, or permanently stop treatment with Tukysa if you have certain side effects. Tukysa may cause fertility problems in males and females, which may affect the ability to have children. Talk to your healthcare provider if you have concerns about fertility. These are not all the possible side effects of Tukysa. Discuss side effects with your healthcare provider. You may report negative side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/safety/medwatch. What should I tell my healthcare provider before taking Tukysa? Before taking Tukysa, tell your healthcare provider about all of your medical conditions, including if you have liver problems, are pregnant, or plan to become pregnant. Tukysa can harm your unborn baby. Females who can become pregnant. Your healthcare provider will do a pregnancy test before you start taking Tukysa. Use effective birth control, contraception, during Tukysa treatment and for 1 week after the last dose of Tukysa. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with Tukysa. Males with a female partner who can get pregnant. Use effective birth control during Tukysa treatment and for 1 week after the last dose of Tukysa. Are breastfeeding, nursing, or plan to breastfeed. Do not breastfeed during treatment with Tukysa and for 1 week after the last dose of Tukysa. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Tukysa may affect the way your other medicines work, and other medicines may affect the way Tukysa works. Keep a list of all the medicines you take and show it to your healthcare provider and pharmacist every time you get a new medicine. Please see important facts about Tukysa at tukysa.com.